Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Varis. Welcome you all in Healthcare with Dr. Varis. Today I will talk about hyperthyroidism, thyrotoxicosis. This is one of the disease of thyroid, when one patient present with heat intolerance and when patient came to doctor with good appetite and lose weight, with fine tremors on his body, atrial fibrillation, palpitation, and then when doctor advised him to get your thyroid profile test, in which he says that your thyroid is functioning over. Doctor gets his thyroid function tests, and then when the thyroid functions test, then thyroid profile is T3 and T4 is raised and TSH level is low, and then it will be diagnosis that you have hyperthyroidism, means the thyrotoxicosis. So it is of two types mainly. Graves' disease is the most common cause of that hyperthyroidism, which secrete, and other is multinodular toxic goiters, adenomas, and iodine induced hyperthyroidism. The most common Graves' disease is pictures is reflecting with the signs of the exophthalmos, when is a eyeball protrude out, peritibial edema on legs. So it's the presentation of the Graves' disease only. In this we have to check about this other signs also. So it's hyperthyroidism in elderly patient only presents with atrial fibrillation and tachycardia and heart failure also. This is a representation of the hyperthyroidism in elderly patients, but mostly the patients comes with tremors and exophthalmos and heat intolerance also. So there are the three ways of to treat it, that is radioactive iodine ingestion and thianomides and subtotal thyroidectomy. The most effective treatment in Graves' disease is radioactive iodine ingestion, and then when it is injected by solution or by capsule, it will reuptake by the thyroid glands. We will use thianomides, the carbamazole, that is prodrug, inactive form. When it will metabolize in the body, it convert into methimazole, the active form, and we use to treat hyperthyroidism. And in Graves' disease, the radioactive iodine ingestion is the most perfect treatment of that, but is contraindicated in a pregnant woman. So in that pregnant woman, we will use thiopropyl uracil and treatment, and then if these all thianomides and Graves' disease, the radioactive iodine uptake fails, then the last one is the subtotal thyroidectomy. It is the main treatment. In the thyroid profile test, we see there is TSH level is very low, when less than 0.1 micrograms, and T3 and T4 are elevated. Only TSH level low and cannot make diagnosis of hyperthyroidism, but when T4 is raised, then it will be constituted as it is the hyperthyroidism. So viewers, it is all about that hyperthyroidism, and you will see in my next videos. Thank you.